In the heart of ancient Israel, a revolutionary set of laws emerged that would shape the course of human health for millennia to come. Picture this. While neighboring civilizations grappled with plagues and mysterious ailments, one small nation possessed knowledge that seemed to defy the very limits of their time. This is the story of how biblical health laws were centuries ahead of modern medicine. Imagine walking through the bustling streets of medieval Europe. The stench of human waste fills the air. Rats scurry between piles of rotting garbage, and the cries of the sick echo from every corner. Now, transport yourself back even further to the time of Moses. In stark contrast to the filth and disease surrounding them, the Israelites followed a sophisticated system of hygiene that protected them from the scourges plaguing their neighbors. But how did this ancient people come to possess such advanced medical knowledge? The answer lies in a set of divine instructions meticulously recorded in the books of Leviticus and Deuteronomy. These weren't just arbitrary rules, they were life-saving protocols that wouldn't be understood by science for thousands of years. Let's start with the concept of quarantine. While medieval doctors were still using lizard blood and pelican dung as remedies, the Bible commanded that those with infectious diseases must dwell alone and live outside the camp. This practice, first written in Leviticus, wouldn't be adopted by European medicine until the 14th century, when Italian ports began quarantining ships to prevent the spread of plague. But the biblical health laws went far beyond just isolation. They mandated washing in running water after contact with bodily fluids, proper waste disposal outside living areas, and even the destruction of contaminated vessels and garments. These practices, so commonplace today, were revolutionary in a time when the very concept of germs was unknown. Consider this. In Deuteronomy, God instructed the Israelites to designate a place outside the camp for relieving themselves and to bury their waste afterward. This simple act of sanitation could have saved countless lives throughout history. It wasn't until the 19th century that the link between proper waste disposal and disease prevention was scientifically established. The dietary laws outlined in Leviticus have long puzzled scholars and theologians alike. Why were certain animals deemed unclean? The answer lies not in arbitrary religious taboos, but in a profound understanding of disease transmission. The animals labeled as unclean in Scripture are the very same ones that even today are known to carry parasitic diseases dangerous to humans. Take pork, for instance. The prohibition against eating swine meat protected the Israelites from trichinosis, a parasitic disease that wasn't discovered until 1835. Similarly, the ban on consuming shellfish safeguarded them against various foodborne illnesses that we now know are particularly common in these creatures. But perhaps the most striking example of biblical medical wisdom comes from the laws surrounding leprosy. The book of Leviticus outlines a detailed protocol for identifying and managing this dreaded disease. It describes a 7-day quarantine period, followed by a thorough examination by a priest. If the condition persisted, the quarantine was extended. This systematic approach to disease control was unheard of in the ancient world. What's truly remarkable is that these laws weren't just about individual health. They were designed to protect entire communities. The Bible recognized the concept of communicable diseases long before the advent of modern germ theory. It understood that the health of one affected the health of all. Now, let's fast forward to the 19th century. In 1847, a young doctor named Ignaz Semmelweis made a startling discovery. He found that when doctors washed their hands between examining patients, the death rate in maternity wards plummeted. This revelation sent shockwaves through the medical community. Yet, thousands of years earlier, the Bible had already mandated hand washing for those who had come into contact with the dead or diseased. The implications of these biblical health laws are staggering. They suggest a level of medical understanding that was millennia ahead of its time. But this raises a profound question. How did the ancient Israelites come to possess such advanced knowledge? Some argue that these laws were simply the result of trial and error over generations. Others point to divine inspiration, claiming that only a higher intelligence could have imparted such precise and effective health guidelines. Regardless of one's beliefs, the scientific validity of these ancient laws is undeniable. As we continue to battle global pandemics and search for new ways to promote public health, perhaps it's time we looked back to this ancient wisdom. The biblical health laws remind us that sometimes the answers we seek have been hiding in plain sight all along. In the end, the story of biblical health laws is not just about ancient history or religious doctrine. It's a testament to the enduring power of knowledge, the importance of community health, and the timeless principles that continue to guide us in our quest for well-being. As we face new health challenges in the modern world, we would do well to remember the wisdom of the ages, enshrined in the pages of a book that has shaped civilizations for millennia. The next time you wash your hands, dispose of waste properly, or practice social distancing during a pandemic, remember, you're not just following modern medical advice. You're participating in a tradition of health and hygiene that stretches back over 3,000 years to a time when a small group of people in the ancient Near East possessed knowledge that would change the course of human health forever.